I interviewed Jamie Farr, who works as a physician assistant at Beaumont Hospital in Royal Oak. She went to Michigan State University and then went to Wayne State University for their PA program. On a daily basis, she mainly writes different types of notes. These notes contain information about the patient, and from the heavy medical language within them, they are clearly directed towards healthcare professionals in the medical field with a prior knowledge of the terms.
The purpose of my writing basically is to communicate with others who are reading with it what my plan is, how my patient's doing, what the plan of care is going to be, what more studies need to be done, how I'm addressing their issues with medications, what their estimated discharge date is, whether we need additional therapies or even with the care management code. Everybody can read my note and understand. They should be able to understand exactly where this patient is, their admission, what needs to be done, what's already been done, and where we need to go. When I'll talk to a doctor more in technical terms. Definitely, when I'm talking to patients, a lot of patients don't understand technical terms, so I'll put it in a fashion to where they'll be able to understand it. Sometimes I draw pictures for patients, use words that they'll understand.
Farr said in the interview that specifically for her specialty, which is oncology, they have a form of communication between doctors called tumor boards. All the doctors on the case sit in a meeting about the patient and get multiple opinions about what should be done. Another name for these meetings is interdisciplinary team meetings. The studies showed that there are gaps in the information being transferred due to miscommunication by the nurses in the study. This is why being able to communicate effectively is vital for a patient's well-being. When asked about the technology she uses in her field, Farr told me she uses basics like her phone, pager, and iPad. She also has to know how to use the computer system and all the medical equipment in the patient's rooms. Technology helps to make things a lot easier when it comes to patient care. For a physician's assistant or any medical career, being able to communicate verbally to patients, doctors, and nurses is one of the most vital parts of the job. Being able to transmit information verbally and through technology is also something a person wanting to go into this field needs to know how to be able to do effectively.